Okay. Morning, good afternoon, everyone, and welcome. It is a real pleasure to know that there are so many friends and colleagues and new participants joining us from around the world. Many of you know me, but for those who don't, my name is Mercedes Mayor Lazal. I am the past president of OMEP, the World Organization for Early Childhood Education, member of the Public Education of Human Rights Coalition, and one of the co-authors of the publications that we are launching today. It is a real pleasure to moderate this conversation. We are delighted that more than 300 colleagues have registered for today's webinar, and 24 organizations have endorsed these publications. Their names will be displayed in the screen, in the chat, sorry, and we will share it with you. Before we begin, I would like to thank everyone who made this work possible. Today, we are launching two complementary studies, Privatisation on Early Childhood Care and Education, and Analysis of Trends, Challenges, and Human Rights Implications, and its companion, the Argentina country case study. These works are the result of a truly collaborative effort together with Raja Kumari Michael Sami, Raji, Program Manager for Early Childhood Care and Education at the Right to Education Initiative, and Carolina Semoloni, researcher and former youth and actual youth or MAP youth representative at UNESCO. I would also like to express my sincere appreciation to Delphine Dorsey, Director of the Right to Education Initiative, and Alice Beth, Coordination of the Public Education and Human Rights Coalition, whose visions, leadership, and unwavering support made this collaboration possible. From the very beginning, they encourage us to work together and to challenge our thinking and help bring these publications to fruition. Many thanks also go to many colleagues and partner organizations who reviewed the draft and contributed ideas, perspectives, and strengthened the final version of this publication. For me, this webinar is also a continuation of a much longer journey. And I believe that for Raji and for Carolina and for all of us is also true. Several years ago, OMEP joined the Public Education of Human Rights Coalition, PERC, and with Right to Education Initiative in many advocacy initiatives to strengthen education as a human right. And this research is another important milestone in that partnership. I also remember that during the UNESCO World Conference on ECCE in Tashkent in 2022, UNESCO invited me to speak about non-state actors in ECCE. That discussion was never about whether non-state actors should exist or not. It was about how we can build education systems that fulfill children's rights while recognizing the diversity of actors involved in the central responsibility of states. And this principle has also guided our international advocacy during the discussions leading to the Tashkent Declaration. I advocate for the inclusion of the Abidjan principles because they reaffirm that regardless the diversity of providers, states remain the primary duty bearers for regulating educational systems and guaranteeing the right to education. The publications we are launching today are a continuation of the same commitment because this discussion is fundamentally about human rights. It is about the right to early childhood care and education from birth, the obligation of the state to guarantee that right, and about what happens when that obligation is only partially fulfilled. Around the world, ECCE is increasingly recognized as a fundamental right and as the foundation of lifelong learning. Yet, public provision and public investment have not expanded at the pace required to fulfill children's rights. In that context, a wide variety of non-state actors have expanded their role in providing education and care. Our starting point today, therefore, cannot be simplistic. Non-state actors are not an homogeneous group. However, today's focus is especially on one part of this broader landscape, the growing role of private actors in ECCE and its implications to the right to education. They include, of course, civil society, organization, community, religious, trade unions, university, and private providers with different missions. As UNESCO reminds us, private actors are only one subset of a broader category of non-state actors. As we affirm in Tashkent, education is a public good and which the state is the primary duty bearer. I said that, but I repeat that. But it is also a sheer societal, sorry, my English, endeavor. A shared society endeavor does not diminish the responsibility of states. On the contrary, it requires strong leadership, clear governance, effective regulation, and accountability. And that is precisely why the question is not whether non-state actors participate. The real question is under what legal framework, under what regulatory conditions, with what accountability, and above all, how can we ensure that every child enjoys the right to quality ECCE regardless of who provide the service? Our objective is not to condemn particular actors. Our objective is to ask a different question. Under what conditions does every form of provision contribute to the fulfillment of children's rights? And under what condition does it deepen inequalities? It was precisely to contribute evidence to this question that we undertook this research. I hope that these publications will contribute to more informed, to more balanced, above all, more right-based global dialogue. Before we move to our speakers, just a few practical reminders. Today, the webinar is being held in English with simultaneous translation, interpretation into French or Spanish. So go to the globe and choose the interpretation channel. Pueden ir al globo y elegir el canal de interpretación. Il y a l'interprétation dans le canal en français. If you have done so already, please select your preferred language. And I would also like to ask our speakers to speak slowly and clearly to support our interpreters. Finally, although this is a webinar, we very much hope that you feel it's like a conversation, and you can, of course, write your questions in the chat. Well, let's begin. And it is now my great pleasure to introduce my friend and co-author, Raja Kumari Michael Sami. Raji has been the program manager of ECCE at the Right to Education Initiative and has led global research and advocacy on children's rights, human rights monitoring for many years. Raji, the floor is yours.
Thank you, Mercedes G. Good morning and good afternoon, everyone. Thanks to the PERC team and especially to the ECCE working group for making this event possible. While the advocacy brief that we published today focuses on various aspects in related to ECCE and privatization, I would like to focus more on one aspect, which is why ECCE is more prone to privatization and how do we understand ECCE within the larger educational framework, and thereby I will set the context, and then my other panelists, they will provide a very in-depth information or details about the other aspects that are generally covered in the advocacy brief. Privatization in ECCE, it is a growing global trend today. Private actors dominate the both segments of ECCE, which is for children under 3 as well as children in early childhood. They operate both in the formal and informal setting. And here is a glimpse of data. And I would like to really thank and acknowledge the UNESCO GEM team for their reports on this aspects and the detailed and disaggregated data they have provided. And in terms of in 2018 and 19, if we see the data, private institutions account for nearly more than 50% of enrollment for children under 3. And similarly, in the pre-primary segment as well, there is an increase from 28.5% to 37%, which is significantly higher than the other levels of education. And in the advocacy brief, we have provided quite a lot of data, which is drawn from the UNESCO report, and a lot of country examples that illustrates this. And sadly, and one aspect is that even when it comes to childcare, even in countries where the state provision is dominant and stable and is well established, we see a growth of private sector, especially with the rise of childcare chains. That's a disturbing trend. And why ECC is more prone to or conducive to privatization than other levels of education? One, first of all, ECC is not a compulsory in many countries, and it is not well established. It has very limited public provisions. ECCE has both care dimension as well as the right to education dimension. It is an integrated aspect. We see ECC in a very holistic manner. So that's why it's integrated with both care as well as with the educational dimension. And when it comes to care, although the right to child care is guaranteed in the international human rights law, but it is still seen as a private or a parental responsibility than state responsibility. The other reasons also, at times investment in ECC is relatively cheaper. All that it requires a small building and 2 classrooms compared to other levels of educations, which requires higher infrastructure. So, and also since ECC is still not established, generally the private participation is accepted as a quicker solution to resolve the gap. And there are various reasons behind it. why ECCE is more prone to privatization. And I would like to highlight only five major reasons here. And firstly, the inadequate legal frameworks and limited recognition of ECCE, both within the care dimension as well as from the education perspective. Just to indicate one data, the ILO data shows that only 57 countries of 178 have national public childcare systems, out of which only 30 offer statutory provision for childcare about 40 hours a week. And similarly, if we consider the pre-primary element, only 63 countries have adopted free pre-primary education. There may be variations within this data because this data is taken in 2021 report. But this is the current, it's kind of gives a trend. And the second reason that I would like to emphasize is the underinvestment in the expansion of public ECCE service. While the budget for education is very low, the budget allotted for ECC is very insignificant. It is in an average of less than 2%. Uh, that's
One
where
minute.
that's where most countries. The other reasons that I would like to highlight and is how national policies promote uh, privatization with ECCE. And we have Uganda example, and we will listen more from Angela. And similarly, the neoliberal policies also promote ECCE, more of a market-oriented approach to ECCE. And also the global development agencies really see public-private partnership and the role of private actors as a key strategy for promoting economic developments. While this has various human rights concerns, from affordability, accessibility, especially for children from rural and marginalized backgrounds, it has implications on older children as well as on women and the ECCE personnel, and also widening the educational inequalities. Finally, I would like to conclude with the recommendations. And these are recommendations put forth by various experts and the human rights forums. They mainly highlight, emphasize two things. One is to safeguard education, especially ECC as a public good, and affirm state responsibility in early childhood development. And secondly, they seek to reverse the high level of privatization in ECCE and regulate and seek accountability and transparency from the private actors. Thank you.
Thank you. Thank you so much for keeping the time also, Raji, and for your contributions. And now it's my great pleasure to introduce Carolina Semoloni. Carolina is a researcher specialized in ECCE and OMEP youth representative at UNESCO. She will share and present the Argentina country's case study. Carolina, welcome. The floor is yours, and you also have around 6 minutes.
Okay, so thank you, Mercedes, and a special thanks to all the friends and colleagues who have joined us today to share insight on this global trend that Rahi has just presented so clearly. In my case, as you said, Mercedes, I will try to just take 6 minutes to share some key elements regarding the privatization of ECC in Argentina, a paper that I had the pleasure and the honor to develop together with Mercedes. Before moving forward, I would like to give a special thanks to the ECC working group and all the organizations whose support was fundamental to develop this paper. I will not to take too much time of this, as Rahi has already presented it so well, but I would like to mention the context in which this paper took place, the growing involvement of not state actors at all levels of education, but particularly in early childhood care and education, especially for children under 3. And as Mercedes mentioned in the presentation of the event earlier today, this has serious human rights implications, particularly regarding the inequalities and disparities it's exacerbated from the early years of life. In this global and critical context, our paper focused on a case study, Argentina, to identify and critically analyze the key trends and policy implications policy implications, sorry, of early childhood care and education privatization on the ground. Just to give you a little bit of context, Argentina is a bicontinental federal country composed of 23 provinces and a federal district. And early childhood care and education provision is largely decentralized to the provinces, creating significant variations across the country. By 2025, according to INDEC data, 42% of households with children unfortunately live in poverty. If we now move forward to consider the early childhood care and education system in Argentina, we can understand this system as a puzzle composed of 3 institutional pieces, which actually reveals different forms and degrees of privatization. We have the official education settings, the early education under the province's Minister of Education, the child development centers, and then the Minister of Social Development. And we also can find a large unregistered or unofficial sector with no formal state oversight. This fragmentation itself, it's a driver of inequality, as children in Argentina have access to institutions with different approaches, resources, and purposes, mainly depending on their age, where they live, and their family income. If we focus for now on the access to the official early education, the pieces of the puzzle I have just described, based on the annual education survey, that it's the survey carried out by the National Ministry of Education. The first finding is that over the last quarter century, Argentina has made a significant progress in ECCE, particularly when we pay attention to enrollment for 4 years old. And this can be explained by the law approved in 2014, under which education became compulsory for 4 years old. And national and provincial authorities are requiring students to ensure universal provision for 3 years old. Despite this progress, access to the early education, it's still a challenge for younger children, as you can see on the screen. While at 5 years old, the enrollment to early education is almost universal. By 2 years old, less than 11% of children are enrolled in early education. And if we consider the rate of enrollment to a state-run versus to private early education setting, what we found is that while the state dominates the provision for 5 years old, it covers only 38% of under 3 population, which means that a significant majority of children enrolled at age 0 to 3 attend to a private institutions. This shows that given the insufficient state provision, many families turn to the private sector to ensure access to care and education for the youngest children. And as a consequence, of course, access to early childhood care and education is often determined by family socioeconomic status, a trend that in the context I have already described reinforces the existing social and economic inequalities. If we turn to the survey that is conducted by UNICEF, the mixed surveys, we have a further picture because the surveys allow us to see the access to the entire EC provision.
1 minute.
Okay, but it has the limitation that it doesn't reach some rural areas. What we found here is that the disparities become even more clear. At 2 years old, only 7 in 100 children from the poorest families attend an EC setting, while these figures rise to 32% among the children from the highest quintile income. And if we take a look at another data source, as the national census, that has the limitation that groups together the attendance to the Child Development Center and the register settings together, it's confirmed the pattern. The older the child, the more likely they are to attend a formal education. The younger the child, the more they rely in this other type of provision. And as Mercedes has mentioned earlier today, non-state actors are not an homogeneous group. Not all registered settings are the same. While some private and community-based providers operate with social or a non-for-profit orientation, there are others that function as market-based services and private business sustained primarily through family fees, particularly in the not-compulsory years and go to 0 to 3. These pictures reflect a broader view of privatization that involves the growing dependencies on household funding, the delegation of state responsibility to non-state actors, and the normalization of market-based solutions for early childhood care and education, especially for children under the age of 3. The impact of privatizations go beyond the children access and the rights, fundamental right questions regarding the state's duty to respect, protect, and fulfill children's rights, and to support educator working conditions and families more broadly, especially women who still absorb the significant proportion of the patriarchy work. Just to sum up, because I know that I am running out of time, there are 3 main structural drivers that explain privatization in Argentina, and they are clearly connected with what Raji has presented. First, the lack of recognition of the 0 to 3 age group as a part of the Argentinian universal education system. Second, the insufficient public provision and infrastructure. And finally, the weak public investment and regulatory framework that undermine the state capacity to provide quality, accessible ECCE, leaving a vacuum that private providers increasingly occupy. Together, these 3 factors create conditions for private actors to expand, not by design, but by default and omission. And just to close, I would like to mention that there are 3 clear recommendations which you can find developed in the paper. So I invite you to download and read the paper and use it. I won't go to them now because I know that Mercedes will pick them up shortly, but they are grounded in a core idea that is early childhood care and education is a human right, a public good, and a public responsibility that require a strong public leadership and clear legal frameworks. So thank you, and you have my email there in case anybody would like to further discuss something after this event. Thanks.
Thank you so much, Carolina. And of course, and we have shared so many times that the belief that research becomes meaningful when it enters into dialogue with real policies, practices and advocacy work. And that is exactly what we hope this next session will achieve. We are now moving to the second part of this webinar. This is not simply a series of responses to papers. Rather, it is an opportunity to broaden the conversation, to bringing together different perspectives for international organizations, civil society, academia, etc. So as you will notice, we have invited speakers from different backgrounds, and they can enrich our understanding and the most important challenges we have in ECCE today. So I would kindly ask our speakers to keep 5 minutes each. And sorry for that. But yeah, and our first commentator is Ana Cristina Dadio. Ana is the Chief of Education Policy at UNESCO Global Education Monitoring Report, the GEM report. And she leads the GEM report thematic and policy work, including its research on non-state actors in education, governance, and regulations. We are especially pleased to have Anna with us today because the GEM report has made and is continue making so important contributions for our work. Thank you so much, Anna. Welcome, and the floor is yours.
Thank you, Mercedes, and good morning, good afternoon to everyone. I am delighted to be here with you, and more particularly to react to these 2 papers because they are complementary. One takes us deep inside a federal country, and the other takes us across the whole world. And they arrive almost word for word at the same diagnosis. I want to draw out that convergence and bring in the other pieces of our GEM report evidence, the 2021/2 GEM report on non-state actors in education, who chooses, who loses, and some follow-up papers that we prepare, for example, for the World Conference on ECCE in Tashkent, and some other work on regulation and governance in African countries. Because what strikes me is how precisely Argentina's puzzle and the global mapping papers worldwide scan reproduce findings. These publications have been documenting continent by continent. And so I will organize my remarks around 6 points of convergence and close with what the evidence asks of us as policymakers, researchers, and advocates. Let me start with the headline both papers share. ECCE is the most privatized level of education almost everywhere, and the youngest children are the most privatized within ECCE. We have just shown that Argentina shows us this in sharp relief. 72% of 5-year-olds are in state-run kindergartens, but only 38% under 3 are. And the global mapping paper shows the same trend at global scales. No state provision rose exponentially from 28% to 37% of pre-primary enrollment. And as we have seen with the latest GEM report that we published in March 2026, on average, however, and globally, there has been a slowdown on the growth in enrollment in pre-primary educations. And for children under 3, privatization, we know, and no state enrollment dominates in many countries, reaching 99% in New Zealand, 93% in Iran. And for the GEM report, this is the consistent finding. No state actors are more present in early childhood than at any other level of education. So the first thing to outline is that Argentina is not an outlier. It is a textbook illustration of a global pattern. And the curve by age, near universally public provision at 5, collapsing towards private and informal provision under 3, repeats almost everywhere we have data. The second convergence is about why this happens. Privatization in ECCE is not simply families filling a gap. We heard that talking about no-state, we are not talking about an homogeneous group. There are very different no-state actors. But it is what happens when a regulatory and financing vacuum meets demand. Few countries address the issues inequity and quality, which can arise when private provision dominates but is hard to monitor. We always see that the poorer households are more likely to attend unregistered centers, for example, and even rural and poor children are far more likely to attend home and community-based settings of low quality. So what we did with the country peer profiles, we checked regulation and governance, for example, and we saw that globally, nearly every country regulates entry and licensing, but only 15% of countries at the global level prohibits non-state providers from operating for profit. And fewer than half, specifically 35%, regulate fee setting at all. And so this is the challenge. That challenge lies in establishing regulation that promote equity and quality. That is exactly the structural picture the global mapping paper draws for Argentina and worldwide. Weak legal recognition of the 0 to 3 age group, chronic underinvestment, and fragmented oversight, which together don't just fail to stop privatization, but they actively enable it. And the underinvestment is not marginal. The issue of the global median for ECCE spending that sits at much below the recommended benchmark of 1% is an issue. And we know that in many low-income countries, pre-primary education receives very, very low shares of the already very thin education budget. Third, and this is where Argentina's 3-piece puzzle becomes more than a national curiosity, the complex landscape I framed for the World Conference on ECCE tells us this blurriness is the rule, is not the exception. The public-private binary breaks down once you look closely. There are public schools that are run by non-state actors, state subsidies, private providers, and outright unregistered businesses operating in the gaps. So that's really an issue, and this blurriness needs to be spoken loudly. And the fragmentation operates also in terms of governance. It's really there that, for example, in many cases, the education ministries, in very few cases, the education ministries hold the ECCE portfolio in fewer than 1 in 3 countries, and care for the youngest. This is something that we have also shown this year report is routinely split across social, welfare, health, and even a religious affairs ministry. That, of course, this fragmented governance does not help the issue in pre-primary transparency and governance. Fourth, public-private partnership deserves specific attention because both papers treat them carefully. And I think the evidence is more troubling than a neutral middle ground implies. The global mapping paper documents 4 PPP models: infrastructure, build, operate, transfer schemes, education service initiatives, vouchers, and management contracts, and is very candid and transparent about the risks. It cites Liberia 2016 decision to outsource public pre-primary and primary schools to bridge international academies. Uganda's case is just as stark, as legislation places financial responsibility for pre-primary squarely on parents. And so as a result, only 9% of pre-primary age children attend licensed preschools, while over 60% receive no early education at all. These are not implementation failures at the margin. They are what happens when privatization enters the legal architecture of ECC. And fifth, and I am almost close to conclude, both paper and the JAMA report converge on the consequences, not just the causes. Affordability, as we know, is the most visible one. Argentina's quintiles gap, where 2-year-olds from the richest households attend ECC at more than 4 times the rate of the poorest, mirror the JAM report's global finding that children from the richest 20% of households are 2.5 times more likely to attend private pre-primary than those from the poorest 20%. And the global mapping paper adds here country detail. Private pre-primary fees consume nearly 22 times more of a rural Indian family's budget than government schooling at the same level. And there are other examples from the United States. The less visible consequence, which all our sources flag, is what
You
this
run out of
does.
time.
I am finishing. What does
Yes.
this to women and the workforce? And this is also something that we need to keep in the equation because it's important and there's a bear on the poverty. And finally, I would say this is the point I'd ask us not to lose. The evidence is not bleak uniformly, and that matters for what we recommend. Where states have invested deliberately, the private share has fallen even as over-enrollment rose. And this is an important, really important message. So the final point is that not the private and community actors have no place, but the papers and the GEM report are really explicit on this. And so, as Mercedes said before, the general comment number 7 to state that non-state engagement can be legitimate and the Abidjan principle. The issue is one of substitution versus complementarity. When the state fails to recognize ECC as an enforceable right, fails to fund it adequately, and regulate entry without regulation equity, the private sector does not complement public provision. It replaces the state's obligation. And this is something that we need to discuss.
Thank you. Thank you for showing us the complexity also of this field and the different actors, not only education, but also because of the fragmentation, other areas of the government. So you reminded us that this debate is not closed and it's not only about provision, it's about governance, evidence, financing, regulation, public policies in a way. Well, our next speaker, thank you, no? And our next speaker is Angela Casule Nawove. sorry. Angela Casule is the executive director of the Initiative for Social and Economic Rights. She is from Uganda, and she brings an extensive experience from research, policy advocacy, and community engagement. Angela, we are totally delighted to have your perspective from Uganda. The floor is yours.
Okay, thank you. Thank you, everyone, for joining this webinar. I've looked at the paper. When you look at the papers, they have been shared, others are coming. You see that governments globally invested in public ECCE, allowing private providers to become the dominant source of the sector. But one message that stands from the papers is that privatization is often not a policy choice, but a consequence of insufficient public investment in ECC. And Uganda's experience reflects this very clearly. But I also want to pick up also from what Raja mentioned in her presentation, that which is true also for Uganda, that national legal and policy frameworks promote ECCE privatization. So when you look at Uganda as a country, the legal and policy framework permits private provision of ECCE while placing the primary responsibility for financing on education of this the education on parents and guardians. And in Uganda, the reality is that the system remains predominantly privately provided. And while we got an ECC policy, which is also a positive step, but the policy, the ECCE policy, which is of 2025, maintains that the establishment and management of ECCE centers is primarily the responsibility of non-state actors, with government intervention only where considered necessary. So, and with that, we see the situation is that access continues to depend largely on a family's ability to pay. And more than 60% of children aged 3 to 5 are not enrolled in any pre-primary school program. And the school fees, the fees that are paid, continue to exclude many low-income and rural families. And while private providers have tried to fill the gap, this policy is largely silent on regulating fees and preventing discrimination, and also addressing the commercialization of ECCE. So public provision is almost non-existent, and fewer than 1 in 10 children attend a licensed pre-primary school. So rather than the country, Uganda, recognizing ECCE as a universally publicly funded service, the policy focuses on targeted subsidies and support for underserved communities. But this is still on paper. It has not been implemented yet. There are also geographical disparities because most centers are concentrated in urban areas, leaving many rural communities with limited or no access to quality ECCE. As an institution, the Initiative for Social and Economic Rights, our take is that we cannot replace state obligation. Private actors cannot replace state's obligation to guarantee every child's right to quality education, and ECCE should be recognized good and not primarily as under to translate the new ECCE policy into action through increased public financing and progressively introduce publicly funded pre-primary education, beginning at least with 1 year of free pre-primary at centers that are implementing universal primary education, but also strengthen regulation and oversight over private providers, because we have them, they are in place. So we want government to strengthen regulation and oversight of private providers to ensure quality and equity. And for us as an institution, The question is not whether private providers should exist, but the question is whether every child, regardless of income or location, can access quality ECCE. And investing in ECCE is investing in equity, lifelong learning, and Uganda's future. So precisely that is what I can say for now. Thank you.
Thank you. Thank you so much. And thank you for your intervention and because remind that policy choices about financing, regulation, public responsibility have concrete consequences on children's access to quality, to equity. Thank you so much, Angela. And now, before we have the intervention of Colette, I want to say that I was looking inside the chat and we have friends and colleagues from Tanzania, Benin, Colombia, Uruguay, Argentina, Morocco, El Salvador, Philippines, Costa Rica, Honduras, España, and much more. I will mention the rest later. And so we are moving to Colette Pine and our next commentator. And Colette is doctoral researcher at the Early Childhood Research Center of Dublin University, Dublin City University. And her research focuses specifically on how marketination and privatization have shaped ECCE systems. So we are eager to listen to you. Welcome, and the floor is yours.
Thank you so much, Mercedes. I'm very excited to be here today, and just the reports that you heard earlier on had a huge amount of pieces that actually connect to my research, which is really exciting actually for me. So I suppose just to start, because I know the timing is we haven't got an awful lot of time. So I suppose my main reflection and simply the recommendations of both those reports is even if privatization can't be fully reversed in the short term, it must be strictly governed so that ECC services and public good is not just private profit. Firstly, the state remains responsible. Even if services are outsourced, responsibility can't be outsourced. Under children's rights principles, the state remains the primary duty bearer. This means the state remains responsible for making sure services, ECC services and providers are accessible, inclusive, high quality and properly regulated. If something goes wrong, the state can't say that it is the provider's problem. Accountability still comes back to the state. Secondly, the accountability has to mean more than just checking whether services are efficient and financially stable. In ECC, we should not only ask how many places are created or whether a provider is financially viable, we also need to ask who is being left out. Is quality the same everywhere? Are low-income families, disabled children, migrant families, or rural communities being served fairly? Are staff conditions affecting children's experience? So accountability has to be included. Access, equality, equity, rights are not just numbers in budgets. So my research connects to two frameworks, but it's the environmental, social and governance framework and the global initial reporting. So I suppose I will talk a little about them later on, but I suppose auditing in a two-way system provides a greater accountability. Usually we think of accountability providers providing reports upwards to the state. And while it is important, providers should absolutely have to report on things like funding, staffing, safeguarding, complaints, and quality. but children should always have ways to raise concerns, be heard, and see how decisions are made. So accountability is not just about the governance and checking providers, it's also about the whole system being answerable to the people it affects. So environmental, social and governance framework, which is actually set within the Global Reporting Initiative, is, I suppose, I think it can be easily described. I think it's can be explained quite simply. In plain terms, it's a way of asking whether an organization is acting responsibly, not just making money. For ECCE, the most important part are social and governance. And the social aspects are our staff paid fairly, our quality is quality supported, our children safe and included, our families treated fairly, our services accessible to different communities. And on the governance aspect is who owns the providers? Is it public money being used? Is profits being taken out of the system? Is it who's making the decisions? Are there proper complaint systems and oversights? So ESG gives us a simple framework for judging whether a private provider is acting like a responsible public service and not just a business. So the GRI reporting makes this more practical. In a simple way to explain Global Reporting Initiative is that it's about public reporting and consistent and transparent way. In other words, providers should not just say they are being responsible, they should show it as well. For example, a private ECE provider could be asked to report publicly on staff qualifications, pay, staff to child ratios, complaints they have handled, inclusion and disabled families or disadvantaged families, sorry, use of public funding, ownership and governance structures. What matters? That matters because one of the biggest problems is private systems is lacks transparency. Often it is unclear who owns services, where money goes, and who is really accountable. The ESG and the GRI reporting makes these things more visible. But I would like to make one final point.
1
These
minute.
frameworks, 1 minute, these frameworks should not be replace regulation. They are more of a substitute for states, support states in doing their jobs. They're an extra tool that can make private providers more open and more measurable and more accountable. So my conclusion is this: we may not be able to remove the privatization, but we can make sure that it does not operate like an ordinary market. If private actors are delivering a public good, then we must accept public rules and public scrutiny and public accountability are part of it. My last point, sorry, if private providers want to deliver public goods like ECE, they must be willing to show clearly who they are serving, how they are operating, and how they are being held accountable. Thank you.
Thanks to you, and very important, the last recommendations. Thank you so much. And I told you that I will mention all the colleagues that are here from Kazakhstan, Hungary, Mexico, Brazil, Ghana, Ireland, Canada, Australia, India, Bolivia, Sweden, Trinidad, Tobago, Iceland, Aotearoa, New Zealand, and Cote d'Ivoire. Thank you so much for sharing today with us. And our final commenter is Cassandra Hallett. Cassandra is the Deputy General Secretary of Education International. And you know that Education International has been a long-standing advocate and publicly funded equitable and quality education for all. They are working all the time. Thank you, Cassandra, for participating in this, and you are welcome, and the floor is yours.
Thank you. And I realize we are almost at time, so I will do my best here. Really, though, it is a privilege to join all of you and to reflect on this very timely analysis on behalf of Education International. My focus will primarily be on the global report, although, as has already been noted, the global report and the Argentinian case study really do come to the same conclusions. So for us, the global report provides a comprehensive and compelling examination of a reality that EI and our member organizations have been raising for many years. When governments fail to guarantee the right to early childhood education through strong public systems, adequate public financing, and robust legal protections, privatization expands to fill that gap. Nowhere is this more evident than in early childhood education. As a global federation of education unions, EI is particularly concerned, but not at all surprised, by what this report reveals regarding the profession. The evidence confirms what teachers' unions see around the world. The expansion of private provision often goes hand in hand with problematic working conditions, including lower wages, precarious employment, limited professional development opportunities, inadequate qualifications, weak labor protections, and restricted access to collective bargaining. Too often, ECE personnel are the lowest paid and least recognized professionals in education systems. Yet, they are professionals, and the education and care they offer to our youngest learners is vital to give those children a strong start. Let me be very clear on this. There can be no quality ECE without qualified, supported, and respected teachers and education support personnel. There can be no quality ECE without decent work. EI welcomes the report's emphasis on international labor standards and the recommendations of the United Nations Secretary General's high-level panel on the teaching profession. These frameworks make clear what all ECE personnel must have, and this actually links a bit to Sergio from Cente's question in the chat. That is the need for fair remuneration, secure employment, quality training, professional autonomy, social protection, safe working conditions, and meaningful social dialogue through their unions. Privatization is often mistakenly presented as a solution to underfunded public systems. In reality, it is a symptom of underinvestment. Governments must meet international benchmarks for education financing, and within those commitments, ECE must receive the priority it deserves. Education International supports the international call for governments to allocate at least 10% of education budgets to pre-primary education to ensure greater investment in the workforce and in public provision. Importantly, the report also highlights the gendered dimensions of ECE privatization. Women make up over 90% of the ECE workforce. When services are privatized and underregulated, it is often women workers who face low pay, precarious employment, and inadequate professional recognition. At the same time, when affordable, publicly funded early childhood education is unavailable, it is women who shoulder a disproportionate share of unpaid care responsibilities, often limiting their opportunities for paid employment, education, and participation in public life. Advancing gender equality therefore requires both reducing the burden of unpaid care work and ensuring that paid care and education work is properly valued, recognized, and supported. Finally, this report reminds us that governments, and this has been said already, remain the primary duty bearers for the right to education. For Education International, the conclusion is clear. We stand with teachers and their unions around the world in calling for universal, free, high quality ECE, adequately financed through public resources and grounded in human rights, equity, and social justice. Early childhood education must be recognized as a universal human right. It must be publicly funded, publicly governed, and available to all without discrimination. It must also be delivered by qualified and respected professionals enjoying decent working conditions and strong labor rights. It must remain a public good, not a commodity, and the reports help point us in that direction. Thank you.
Thank you so much, Cassandra. And we run out of time, and so many things so important to continue working and discussing together. If you have any question, or you want to continue the dialogue in our LinkedIn, it is available to continue this conversation. And final thanks. Before we close, I would like to express our gratitude to everyone who made today's webinar possible. First, to Raha Kumari and to Carolina, because for their commitment, expertise, inspiring collaboration, and this for this research. Our heartless thanks to Delphine Dorsey, to Alice Best, to Ruth Thornton from PERC, for their vision, their leadership, their support all the time, to the Global Campaign for Education that provided the translation and the technical support for this session. On behalf of OMEP, of course, I would like to thank our partner organization, in particular the 24 organizations that endorse this publication. And my sincere thanks to our distinguished speakers, the last panel, our interpreters, of course, to each of you that joined from around the world. The final words for me is today's question was, what is at stake? Our answer is simple. What is at stake is every young child's right to a fair start in life. And today's discussion has reminded us that private provision does not diminish public responsibility. On the contrary, it calls for stronger state governance, stronger regulations, and renewed public commitment to children's rights. Thank you for being with us today, to your commitment to young children, for helping us to continue this important conversation and fight. Together, let us ensure that every child, everywhere, enjoys the right to early childhood care and education from birth. Thank you very much, and goodbye. See you soon.